Good morning, everyone. So nice to be with you. And wow, this is really impressive because, in a lot of ways with local conferences that cost very little or, cost nothing, you see a very poor turnout because it's like, people seem to think that things that are really expensive are more important. So I'm just glad to see you all here. And unlike Dr. James, I do have a conflict of interest to report, and that is, this is my home. I was born in Old General. I live still within walking distance of this facility in the house that my mother bought in 1969 after the state put in initiatives not only to eliminate some of the segregation that occurred because of redlining, but also some of the programs that we have today that help Delaware first-time homebuyers get homes initially started in initiatives to help the African-American community. So if you could come up with $500 cash or a check that was going to clear, you could buy a house. My mother and her ragtag, band, about 4 children at that point, were the first Black family to live on our block on Washington Street between 27th and 28th. Now, today, that neighborhood is not only not a mixed neighborhood, it's exclusively African American, and it's seen better days. And more importantly, with all the letters and acronyms that you see up there, I am not an exception. I am not an oddity. I am who I am because I grew up in the shadow of the Riverside Projects. Every Black mother that made sure that I didn't get in trouble, every older Black girl that was my big sister, and all the ones we cared for, that's what you need to take away about what the Black community is if you don't have the opportunity to see that on a regular basis, okay? So since Dr. James basically said everything that I need to, if I had to, I could say this: educational equality, income parity, reproductive justice, universal health care, culturally appropriate mother-centered care, community-based doulas, paid family leave, eliminate cash bail. Thanks for coming to my TED Talk. I'm going to sit down. Okay? And I know for a lot of people that last talk might have been a little emotional. It may have been a little triggering. It made you feel some kind of way. But, if you are over about the age of 90 up to 400, if you are magical and you have been on this earth for 4 centuries now and living in the United States, raise your hand. No. So what that means is you are, in fact, not responsible for a lot of the things that we're talking about today, whether Black, white, or otherwise. We may have benefited from it. We may still benefit from it, but we didn't cause it. So there's no need to feel uncomfortable, and there's no need to, thinking in yourself, why am I here? But don't white mamas matter? Don't all mamas matter? What is she talking about? So the Black Mamas Matter Alliance is what it sounds like. It's an alliance. It's a coalition of women. We're all Black women who are professionals in different fields. We have public health researchers, physicians, Dr. Joy Creer-Perry, who's one of my personal mentors. Even though she's younger than me, I'm going to be her when I grow up. Ladies from Sister Song, the Reproductive Justice organization. Basically, in 2015, we're all sitting around and saying we're all frustrated. We're all, feeling marginalized ourselves as professionals, and we know that the women and families that we want to care for feel marginalized. So how can we come together? How can we maximize our talents? How can we bring our resources around that common purpose and develop some collective power to be able to make change? At the system level, yes. But even at the community level, because when people ask me these questions, I often say that, I'm usually in rooms where we have a micro group trying to fix macro problems, right? Because really, everything that we're talking about with Black maternal mortality, infant mortality, doesn't happen in the year around pregnancy and childbirth. It happened from the day that mother was born. And even then some. I tell mothers all the time when they're coming in for their first prenatal appointment, just imagine the fact that your genetic material that's going to become your grandchildren someday are already living inside of you, right? Every egg that someday may be your potential grandchild is living inside of you when you're gestating. That is powerful on a spiritual level, but it's also powerful on a community level and as an institutional level to say, what are we doing when we're talking about infant mortality now? You really should have been looking at my grandmother, right? You really should have been looking at my grandmother. And so when we think today, we see a lot of the results, and sometimes we're like, oh man, we're 55 years after the Civil Rights Act. Why can't people get it together? Why can't I get it together? Because, you're still dealing with the things that happened with my grandmother, who was born in 1917, and the Jim Crow South, where she legally, in the state that she lived in, didn't have the right to go past 8th grade, vote, and be on the right side of the street. So, just think of it that way. That's who we are. We're a bunch of frustrated, official, angry black women. Please don't think of us that way. We're trying to just change the world, and we are so thankful for the allies that we have. If you are here in this room, I am assuming one of two things. You either did not know what the topic was, or you were like, yes, it's time to act. And so I'm going with B. So when we leave here today, and you're going to hear a few more things, and it's going to be about our own state, and it sounds like it's painful and uncomfortable, but please don't, because like I said, I am a product of some of the changes that happened in the 60s and 70s in this state that were brought by people who were very forward-thinking and were almost all white, and gave us opportunities that I would not have probably had otherwise. And we've seen some reversal in changes, and it's time to shift that clock back. So we want to change policy. I want research that will prove to you that it is not the color of my skin, it is not my race, as you call it is not my blackness that makes me at risk. It is 400 years of organized oppression that really was designed to keep specific groups of people out of power. And unfortunately, at the advantage for other people, right? And so now it's just time to destructure and dismantle it. So why? We've heard this, black mothers 3 to 4 times more likely to die. But we also have near misses and serious complications every day. And as far as we're concerned at Black Mamas Matter, that's a human rights crisis. And you may not know this, but the United Nations actually at one point looked at the healthcare disparities in the United States and agreed the same thing. Dr. Perry-Joya has actually testified before the United Nations about things that can make substance change. So what we want mostly is 2 things, and maybe we could even flip-flop them from side to side. One is birth equity. We want the assurance that we have all the conditions that we need for optimal birth for any woman, and a willingness in all the stakeholders possible, both at the individual and at the system level, to make the changes that we need to address the inequalities that exist. Knowing that, again, it wasn't our fault. We're just trying to fix somebody else's mess. You ever move into a house that was foreclosed on and they left all the garbage? They might have took the copper, but they left all the garbage. That's where we are. And then our other model, of course, is reproductive justice, knowing that some of the women from Sister Song helped found this organization, and Loretta Ross, one of the founders of Sister Song, actually defined the term reproductive justice. And so what I'm going to say to you today, and this may, as you've heard them say, I am employed here locally. Today may be my last day. I've got a resume. Reproductive justice means that if I don't ever want to exercise my fertility, or if I don't want to exercise it today, I should have the right to have the access to whatever safe, effective, legally available method I need to make that decision at that time, whenever I want to make it. It also, right? But it also means that if I want to have 8 babies, even though I'm low income, with a high school diploma or maybe not, living in a trailer or living in the projects, that's my right. And you don't get to make that decision for me. And for a lot of young women in this, in this state, whether they are urban young women from, local, or some of our young ladies in some of the southernmost areas, I had a baby 9 months after I graduated from college, because that's what you did. You went to college, you got married, you had a baby. Maybe somebody should have talked to me about reproductive justice a little sooner. But if you're 18, if you've attended a school that was okay, or maybe not so okay, and your future is going and getting in a job at the Amazon Fulfillment Center or the Walmart Distribution Center, 18 is the time where you're living your life. You're doing your thing. Maybe that is the time that she's ready to start her family. And unless we're going to change things in society that says that these women should have more options, then that's her choice. What reproductive justice isn't are programs that target, and I hate that word. The two words I hate when I hear about health care when it comes to minorities and low-income folks is target and they. But if you are targeting a specific population, whether it's based on income, race, disability, or your personal opinion of whether or not the number of children they have are a burden on society, that's eugenics. That's not reproductive justice, and it doesn't have any place in conversation. Your goal as healthcare providers, your goal as advocates, as community members, is to make sure that every woman knows her options and has access to them, and that is all. And you often won't understand their choices, so maybe this would be an opportunity for you to engage people in the community for just that reason. And be willing to know, and especially in this, in the context of Black women, we know what's best for us. And we're also surrounded by a community who is there to advocate for us and be with us. And so rather than trying to talk down to people, sit down and listen to people. And also find your stakeholders in the community that may have purchase that, we don't at all. So we've talked a little bit about some of these things, so I could just slip through some slides, but I really would like us to be willing to think about, I know that word racism that we heard in the last presentation was really hard because we have our own mind what it means, and it's an attack. It says something about my character. I am racist. This system is racist. We have turned that into such a negative word, and there's a lot of ways that it is, right? But we're saying that this is a system that's been built a certain way, and racism is the result. It's not necessarily a character of who you are or the institution that built it, and again, it's just a fact. And we should consider that along with those social determinants of health, and not race. I often, we hear it all the time. We're taught to do it when we're in school. The patient is a 32-year-old African-American female with a past medical history of blah, blah, blah. If we didn't include race, we did something wrong, and somebody would probably, stop. What's her ethnicity? And you're panicking. But I want to challenge the paradigm today. If I were to put up a picture of a microarray and the finest genetic minds were in the room and said, point to the one that determines my race, they couldn't do it. There's one that determines my melanin synthesis and how dark or how light I get, but that's not defining who I am. I am more than the color of my skin, and frankly, I am more than the experiences that I've had as a result of the color of my skin. Race isn't a genetic cluster. Yeah, sure, there are inherited traits of people who live in certain regions, but, but as we know in the United States, there is so much interesting intermingling of people from ancestral backgrounds that, I bet it's just like the best pot of gumbo if we were to look at a lot of our genetic backgrounds. It's delicious, and all those differences are fantastic. My sister did Ancestry.com DNA with her kids and her husband for a Father's Day gift, and we were all shocked. Turns out that I have just as much European ancestry as I do African. And I even had some Asian. We still can't figure out where that one came from. Nobody's answering. You know, race was really, at the end of the day, invented as a social construct for people from a long time ago with evil intentions that none of us have in this room here today, to make it easier to justify why I would do things like commit mass genocide of indigenous people, why I would go to another continent and kidnap people from their homes and use them as forced labor, why I would take poor people from another part of Europe that look like me but make them indentured servants. I don't know if anybody here is of Irish background, but did you know until somewhere in the middle of the 19th century, you weren't considered fully white if you were Irish? Anglos were considered fully white. And these were laws that were codified on the books. But thank God so many Irish were Catholic, because it was the power and the finances of the Catholic Church that was able to change some of that. So, when we think about context and we're saying it's just all black and white, it really isn't. Race affects health in a lot of ways. I'm not going to lie to you and tell you some days it's just not hard being black in America. And I'm not going to tell you if you checked my blood pressure at 10 o'clock at night, if I had a long day doing whatever, not necessarily my job, because I love what I do. I get to catch babies, right? Who doesn't love babies? And I get to give them away. But sometimes it's hard. It's hard when people are constantly asking you questions. It's hard when people are constantly judging you. It's just amazing. It's hard when people say things to you that are just so hurtful, and you know that you will probably be retaliated against if you say something back. I will tell you, one day I was at work, not at the hospital that I work at here, but at another hospital. And one of my patients came in labor. She was 24 years old. She was having her fourth baby. She worked, but she doesn't make enough money, or little enough money under the rules of the Medicaid expansion in the state I was living in at the time to still qualify for Medicaid. And as I came in to see her, a nurse came up, and it was a nurse that I'd actually respected. Yes, she loved her to death, walked up to me and said, "You know what? It's the 21st century. I can say whatever I want." And I'm thinking, okay, what? If your patients, I worked at a county hospital, are going to come in here and drop babies that I then have to finance with my tax dollars, then I should be able to say she gets an IUD. She said that out loud. She said that in the middle of a nurse's station. So she meant it. But what was going through my mind was like, and it's the 21st century, and I could probably slap this woman and get away with it. 50 years ago, I would have been lynched. So that ability, and to be able to say something like that is powerful, because she has lived in a world where she has the right, because of the institutional policies that were put in place, to be able to say that about the people that as nurses, I think it is our privilege to serve. And if she would say that about someone that she is supposed to be taking care of when they're at their most vulnerable and active labor giving birth, how does she live her life? So this is a bigger chart that looks at the social determinants of health, and really just to codify what Dr. James was saying, where we are today with the social determinants of health just didn't happen in a vacuum, right? In between, on the other side of my family's home and the church that we attend on the far side, is the old Riverside projects, not the new part. The new part, which is beautiful, by the way, that it's amazing to see what the state did to make sure that people have lovely, humanistic housing, and not to feel like you're a second-class citizen. But all of those causes up there at the top: institutional racism, legal policies that were on the books until really within the lifetime of many people in this room, class oppression. Being poor in America is hard because people automatically assume they're better than you. Being poor and black in America is really hard. And then there's gender discrimination. Women, we just had Equal Pay Day, Gender Equity Day last week, and someone pointed out to me that women today in America earn 80 cents for every dollar that a man earns, assuming they're doing the same job with the same qualifications. And we still haven't passed the Equal Rights Amendment in the United States, by the way. So you take a group of people or an individual who has the ability to exert societal or local force that have a bias against a certain population. And they can use that power to oppress that population and set up structures to maintain that advantage over time. And that is what structural racism is. Exactly that. And how that manifests today, because remember, we say that, women earn 80 cents of every dollar. Well, that's not really true. White women in America earn 80 cents for every dollar a man earns. Black women in America earn 63 cents for every one of those dollars. I might need to go to HR. And how does that happen? And how is it okay? How is it that there are still places today where there's different pay scales? And I once had an employer tell me, honestly, that she did, in fact, and it was a woman, pay men, male nurses, more than she paid female nurses, because after all, they were the breadwinners. I will tell you that I love my husband. He's a wonderful man. He's a book editor. I have out-earned him for the last, I don't know how many years. He does not know it, but it doesn't matter. So let's talk about Delaware, and I won't go over the infant mortality because somebody did, but here's an interesting slide, and it talks about life expectancy from, at birth, but based on the educational attainment that you get by age 25. And you can see that even when African Americans achieve great strides in educational attainment, right? I am the world's most overeducated, anything you've ever seen. I've got, why? Why have I spent more than half my life taking classes? But it didn't actually do much to improve my life expectancy. But shouldn't it if I'm making more money? And I'm living in a better neighborhood? So I believe that a lot of the root of this comes down to education. On the left, there is a map that looks at educational attainment by zip code, which, basically the graduation rate. And that dark area, the darkest area all the way up at the top is the zip codes 19801, 19802, basically a lot of those zip codes that we're looking at when we're trying to figure out what's going on. And then all the way farther down in the south and rural areas. So some of the people that we're most concerned about are getting the poorest education and then not necessarily sticking around. There's another map that you can look at on a website called EdGap, where you could overlay this map and it looks at SAT scores, and assuming that an SAT score of 1,000 says that you're college ready. And guess what? Those same kids are not college ready. So if they're not college ready, where are they going to go when they graduate? On the right is just an interesting little graphic that you should know that the lowest 20% of income earners in the state of Delaware, this is, 20% of the population is somewhere around $20,000. The top 5% control 10 times more wealth than the lowest 20%. And most of us are probably in that middle 20%, and they still control 5 times more the wealth than we do. That's kind of frightening. So I'm going to talk about Wilmington and Dover because those are the two largest cities in the state. And interestingly, they are the cities with the largest population of African Americans, and people of color in general. So the city of Wilmington is about 56 to 58% African American, depending on which survey you look at, about 12% Hispanic. I suspect that number is more because there may be some people who are afraid to be counted. So even though it would increase the population overall, it still would increase the percentage of Hispanics households we have. 77 out of every 10 people in the city of Wilmington are people of color. In the city of Dover, 42.5% of the population is African American. That's the largest ethnic group. There is no group that has more than 50%. Look at those incomes. The median income in the state is $61,000. The median household income in Wilmington is $36,000, and in Dover is $45,000. The average per capita income of a Wilmington resident is $26,000. Like, some of us spent more than that on vacation this year. Medically underserved, it's a medically underserved area by virtue of population density and the number of providers to population. And what I think is interesting when you consider if 70% of the population of Wilmington are people of color, then a little more than 70% of the women of reproductive age are women of color. And I've counted on my hand, non-scientifically, there are less than 10 reproductive health providers in Newcastle County that look like them. Imagine ever going anywhere in your life if you in this room happen to be, to have won the genetic lottery and be Caucasian, where you would walk into a room, a business, and nobody would look like you. We know about the maternal morbidity and mortality risk factors, so I won't belabor them. But when you think about the medical risk factors that we have, but you think about the social risk factors, when you see a mother who's 28 weeks, who's got insufficient prenatal care and all the things that we connotate as wrong and what she's doing wrong, is it because she's black that she gets preeclampsia, or is it because she lives in substandard housing, has to take multiple buses to get to and from work, to pick up her kids, that there isn't a grocery store within 2 miles of her home? Do you know 60% of the people who live in the city of Wilmington don't live within 2 miles of a grocery store? So where do they buy their food? Dollar stores and grocery stores, and Dollar General and mom and pop shops. Like the only fresh fruit in the corner store down the street from my house are bananas and oranges and apples. That's not going to cut it. And when we think about those root causes of inequality, because I know I'm going to run out of time, I want to just remind you that it's not also only about income. We know that oftentimes there are things that happen in the exam room, in the office, that make a difference. Serena Williams, who I will just die on the hill that she is probably one of the most physically perfect people that God ever put on the planet, almost died from a pulmonary embolism and then a hemorrhage after she was being anticoagulated. She'd had a PE before, and she told the nurse that it had happened. And they told her, "Oh, baby, that's just the pain medicine. Go back to bed." She had to argue over and over again, and it wasn't until her partner, now her husband, who happens to be a billionaire of Armenian ancestry, pointed out that, by the way, that's Serena Williams. Like, look at her body. If she says there's something wrong, there's wrong. Why did it take until the white man in the room said something that people acted? On the right is Kira Johnson. I don't know if anybody here was at the Martin Luther King event at Christiana Hospital. But she died as a direct result of hemorrhage after a routine C-section. So when we talk about this, we know that implicit bias exists in reproductive health. We know that we have our biases. We know that we believe things that were decided about African Americans back in slave times. Sam Cartwright, if you have a spirometer in your office and you evaluate people's vital lung capacity based on that, most of you have one that has a button that pushed black, and that changes the values. That was based on Thomas Jefferson's assumption that African Americans had lower lung capacity and therefore we wouldn't thrive well on our own. We all know who J. Marion Sims is, the inventor of the speculum. Every woman in the room hates him. Do you realize that he did all of his experiments on enslaved black women and on Irish indentured servants, and he never gave any of them pain medicine? So I do want to leave you with one of the ideas to do is something called implicit bias testing. I've done it myself because it helps you realize where the issues are in your own brain. I did it myself. I was surprised. I'm sure you will be too. It turns out that I have a preference for dark-skinned black men in professional settings, which means by extrapolation that it means I have a bias against white women, and I reject that because I have white friends. But I'm going to lean into that, and I'm going to embrace the fact that maybe this test is right, and I think maybe you should too. As an institution, sometimes you just need to take a look and evaluate what's going on in yours, and one of the ways to look at that is, what does your workforce look like? If you want to convince me as a consumer that you respect me as a woman of color, then show me the women of color in your practice, in your company, in your leadership. These two pictures are two institutions. One is Harvard and one is UC San Francisco that realized they had a problem with bias, and they made an intentional effort in their OB/GYN residency programs to diversify their residencies. And I think that's fantastic. And then the last thing I want to say in closing is you have hundreds, thousands of community-based organizations with people who have first-person lived experience of what it's like and what these communities need. Instead of expending lots of energy and lots of money designing new programs that you're going to carry out and 5 years later failed, why don't you talk to the people in the community and see what happens? This is one that's one of my best friends. She's a doula and was a lay midwife, and she developed a community center where she wasn't just addressing the fact that they wanted to have unmedicated birth, but they had so many other issues. And, you know, we could all learn from that. And one of the things that we can learn mostly is to use your resources. That's my favorite midwife on the planet, Jenny Joseph, who runs an easy open access clinic. That's my organization. If you want to know, call me later. Those community-based outreaches can save you money, can give you better results, and can pair you together with the resources that you need. And so these are all of the agencies and all the community partners we have in Black Mamas Matter Alliance. And our primary job is to all come together with one common goal, and that's justice. And that's my time. Overtime. Thank you.